Hi, I'm Jay Tyler. In this week's video, I'm going to talk about some considerations when making Hawley retainers that will help cut down on some of that valuable chairside adjustment time. It's always good to have both upper and lower models, even if you're going to make an appliance on just one arch. Reason for that is without the opposing arch, you can't tell how much overbite or overjet there is. Now, overbite is a vertical measurement of how much the upper teeth overlap the lower teeth. Overjet is a horizontal component that determines how much distance you have between the lower and the upper teeth. So overbite is pretty important to know. If you have a deep overbite, then the acrylic on the lingual has to be so that it accommodates that. Now this particular case doesn't have much overbite at all. Now what I do is I will take a pencil and go inside and mark right along the incisal edge of the lowers so that it makes a mark on the upper. And then I will take something like my number 7 wax spatula or a Bard Parker or something and etch right above that line so that this will leave a mark on the acrylic. And when I trim the acrylic, I just make sure I go below that mark. That way I know I'm going to be out of the way of the incisal edges of the lower. Now another thing as far as overbite goes is if it's got a deep overbite and you place the labial bow on the lower up at the incisal third, well, it's probably going to bite on the upper teeth are going to bite on the wire. So you got to make sure that you got the wire out of the way. Another consideration is the buccal cusps on the upper overlap the buccal surfaces of the lower. So whatever clasping arrangement you have, you got to make sure that it accommodates that. Now as far as wires crossing the occlusal, if a wire or a particular clasp is prescribed and it crosses the occlusal and they bite on that wire, there's not much you can do about that. You can call the doctor and say that's a real tight occlusal contact point right there and suggest maybe some other clasping, but if they insist on it, that's really out of your hands. Now I've already made these appliances, so I'm going to stick them on here and we'll look at this. So you can see the etch mark I've made, and I cut the acrylic nice and below that so that the acrylic is on that flat spot just inferior to the cingulum. So that's going to be a nice lingual retentive area. And on the lower, we've got that labial bow so that there's plenty of room for what little tiny bit of overbite they have. And then the clasping, these are Adam's clasp, and we've got the cusps out of the way so they're not biting on any part of the clasp. Now this particular case has a pretty open occlusion for the clasp wires to cross. So this particular case is ready to go. We'll pop it off of here and disinfect it and bag it up, and it'll be ready to see. So we'll see you next time.